Endometriosis is a disorder in which tissue that normally lines the uterus grows outside the uterus, in the ovaries, tubes, or the intestines. Endometriosis tissue acts as the lining inside the uterus would. It thickens, breaks down, and bleeds with each menstrual cycle. When endometriosis involves the ovaries, cysts called endometriomas may form. Surrounding tissue can become irritated and form scar tissue. Bands of fibrous tissue called adhesions also may form. These can cause pelvic tissues and organs to stick to each other. Endometriosis is a progressive condition, which means it can gradually worsen over time. As more and more patches of endometriosis tissue grow in the pelvic and abdominal areas, they can block the reproductive organs. This makes it harder for sperm to reach the egg. Endometriosis can also affect fertility by preventing an embryo from implanting, scarring the fallopian tubes, affecting egg growth, creating a hormonal imbalance in the body, and causing chronic inflammation in the pelvis. Now, choosing what age to get pregnant is a very individual decision that will not be the same for everyone. However, it is important for people with endometriosis to be aware of their fertility in order to advocate for themselves and make informed decisions. Because fertility declines with age, so most experts recommend trying to conceive before 32 years of age. Also, the risks of having pregnancy complications increase with age. People who are older than 35 have a higher risk of miscarriage, stillbirth, preterm birth, and other pregnancy complications like gestational diabetes and high blood pressure. Now, several treatment options are available for ladies who have endometriosis and who have not become pregnant after 6 to 12 months of trying. The treatment a doctor recommends depends on the stage and the type of endometriosis that the lady has. In the early stages, your doctor may recommend a laparoscopy. Now, a laparoscopy is a very simple procedure where a medical professional inserts a camera through a small incision in the stomach. A doctor can use this to assess how many lesions a person has and surgically remove them if necessary. Although laparoscopy is a simple surgery, it comes with some risks. If doctor removes lesions from an ovary, they can decrease the number of eggs that the person has. For people who are 35 years or older, the doctor may recommend ovulation induction with intrauterine insemination instead of surgery. Intrauterine insemination, or an IUI, is a treatment when the lady has to take some medicines, tablets or injections, to trigger ovulation. When they are ovulating, the doctor will place the sperm taken from the partner into the uterus with a very thin catheter. But if you are in the later stages of endometriosis, your fertility doctor will probably recommend IVF. Now, IVF, or in vitro fertilization, is a treatment in which the lady has to take certain fertility medications that promote her egg growth. The eggs are then extracted from her body and they are fertilized with her partner's sperms to create embryos in the embryology lab. These embryos are then taken and your doctor will then implant them inside your uterus. For infertility caused by endometriosis, rates of pregnancy are much improved by IVF treatment. But we must remember that each patient is different, each case is unique. So exactly which treatment is right for you depends on a variety of individual factors such as your age, egg reserve, tubal condition, severity of endometriosis, and your partner's sperm parameters. So personalized treatment protocols are made depending on each patient's needs. Thank you.